I remember one man telling me that his stepfather broke his arm when he was 6 months old. I've had people that have had years of physical and sexual abuse, so horrific stories. Never really cried. I'm not really a crier. I don't know what to tell you. I'm a big boy and I wear big boys pants. Hello cruel world, my name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. That over there is my homeboy, Rudolph the Red-Nosed Reindeer. First of all, I just want to say to everybody, I shmish you a Merry Shmishmish and a Schmappy New Year. This is my 10,000 subscriber celebration AMA Ask Me Anything videos. Thank you so much for everybody that's subscribed. Thank you for your support on this channel. And if you haven't subscribed, I just don't know how you can sleep at night. So you asked me some fascinating questions and I'm going to answer all of them in this video. Well, actually not all, most of them. There's one or two that I've not answered, only because they're either a repeat of a different question or because the answer's so long and complicated that it deserves a whole episode on itself. As well as answering all those questions, I'm also going to address a couple of new things. I'm going to reinvigorate, I'm going to revive an old nickname of mine from my university days at medical school. I'm going to tell you briefly about some changes that are coming up on this channel. And probably most importantly, I did promise you a present of me battle rapping on TV, and I will give you that because you deserve it. Okay, so let's get started. Great questions, by the way. I asked for them in a previous video, so I'm going to tell you what the questions are, then answer them. You know how this works. All right, first question. 𝐏𝐬𝐲𝐜𝐡 𝐅𝐸𝐲. Firstly, congratulations on your achievement. Thank you. The questions I have to ask is, number one, in movies and some TV shows, people portray psychiatrists in a weird way. What is your opinion on this? Shouldn't it have to be changed? Yes, 𝐏𝐬𝐲𝐜, I do agree. I think there's a tendency to have psychiatrists as being old, fuddy-duddied, white, bearded men, sometimes with pipes. So specifically, I'm talking about people like Frasier and the dude from Good Will Hunting. Well, first of all, I think they conflate psychiatrists, such as me, who treat mental illness and prescribe, with psychotherapists, who are the kind of people that sit down and talk about problems in the long term. Some psychiatrists can be psychotherapists, but that is actually very rare. So yeah, I do think it's a problem. I do think that it's a bit of an old, archaic kind of way of looking at our profession. I've worked with dozens, possibly hundreds of psychiatrists, and whereas some are like that, they're from a different kind of background. They're, different ethnicities. There's a lot of female psychiatrists. In fact, I think the balance has tipped to there being more female psychiatry, at least trainees, coming into the system now than males. So yeah, I do think it needs to change. I think it's a bit kind of old school, a bit archaic, but these things take a while to come into the public consciousness. Question number two from 𝐏𝐬𝐲𝐜. What inspired you to choose this career and what inspired you to start a YouTube channel? In terms of the career, I'll give you a very short answer, otherwise this video would be too long. Didn't really know what I wanted to do throughout medical school, stumbled into psychiatry kind of by accident, really enjoyed it. I thought the patients were fascinating, stepping into their kind of delusional worlds, or when they're at the lowest ebb, such as after suicide attempts. Also, the people I worked with when I was a medical student who was psychiatrists were by far the nicest, friendliest, most approachable out of every teacher in medical school. So I just had a connection. And then once I started my training, I did forensics, which is dealing with mentally disordered offenders, people in courts and in prisons, in psychiatric units. And most of them have some sort of backstory. So they have some reason that they're there, whether it's poverty, abuse. So that's what drew me into forensics. It's the patient's individual stories, as well as, if I'm being completely honest with you, the slightly gory nature of some of the offences. 𝐏𝐬𝐲𝐜, you're asking a lot of questions here. Was there any, number three from 𝐏𝐬𝐲𝐜, was there any case you encountered that caused so much fear in your mind? I wouldn't say there's anything that caused me personal fear, but there's certainly a couple of cases where I kind of, it blew my mind in thinking that it was completely senseless and completely random violence. So for example, I saw a case recently of a man who tried to, and luckily failed, commit a series of sexual assaults by going up to random women on the street. He was getting into random women's car. I think he did it twice. He got into their cars and like tried to grope them and feel them. Luckily, both times the women managed to escape. But yeah, so it doesn't cause me fear, but it causes like fear on behalf of other people, women in the public. I also assessed a tragic case of a man who stabbed a slightly elderly gentleman completely randomly in central London because he was suffering from auditory hallucinations at the time. So stabbed and killed a random dad in his 50s. Obviously that's so tragic. I mean, all killings are tragic, but the randomness of that is quite worrying, but again, didn't scare me personally, if that makes sense. One last bit for Resmi I forgot to answer. What inspired you to start a YouTube channel? The short answer to that is probably 20% my narcissism, 60% because I genuinely think I have interesting stories and insights from my many years of assessing hundreds of people that have committed serious crimes with severe mental illnesses, and 20% because I am a bit frustrated at the misinformation of people that talk about my area of expertise without, in my view, the expertise and the experience that gives them the credibility. So this is to combat those people. Okay, let's move on to a new person. Next question, the one. What are your thoughts on ketamine to relieve depression? Loads of ketamine clinics popping up in the States and it's been used in India for many years. Got to be better than ECT, which will one day be looked at in the same way as we look at the lobotomy. Good question, the one. So if I'm being completely honest, I don't have that much experience of ketamine in depression because of the area I work in. So the patients I see very rarely have depression. They might have comorbid depression, but it's very rarely their primary diagnosis because depression doesn't lead to violence or aggression as commonly as something like a psychosis would. And also the patients I see are already inpatient units, already locked up in psychiatric units or in prison. Ketamine use would be more experimental, more for community kind of psychiatrists. Having said all that, what I know about what I've read about ketamine is that it's very good in the short term and it can relieve depression for a day or two or for a few hours. And studies have followed patients up over about 2 or 3 days, but there's very little research in the long term. So to answer your question, I've got nothing against it. If it works, then I don't have any kind of moral reason why we shouldn't use it. But I think because it's potentially a dangerous drug, like all drugs, illicit or not, we need to wait till we have more data in the long-term use before I personally would feel comfortable prescribing it to any of my patients. Also, learn how to spell ketamine, the one. Okay, next one. Orbital. What's that tattoo of and how many do you have? So you probably spotted my tattoo. So this tattoo is kind of vaguely represents forensic psychiatry actually. So you got the psi in the middle for psychiatry, and then you got a skull, which kind of represents, the human head where the brain is stored, as I'm sure you know. On this side is criminality. So I've got a man holding a sword, some handcuffs, and then you won't be able to see this necessarily, but Sigma Delta, which is the name of my limited company. So that is like my logo printed on his hand. And on this side is treatment. So we've got a pen, which represents writing psychiatric reports, tablets, which represents a form of treatment, and injections, which represent another form of treatment. I do have another tattoo, but I'm not going to talk about that. Not because it's a secret or anything, it's nothing to do with psychiatry, and I am aware this video might get too long. Okay, Ben E, what are some of the most unhelpful stereotypes or misconceptions regarding psychiatry and criminal behaviour? I think, to take it down to a very basic level, I think that there's a common misconception that people with serious mental illnesses are dangerous or are violent. And I'm very kind of aware and sensitive about contributing to that stigma. So as I will say clearly now, and I have said in many of my previous videos, the vast majority of people that have mental illnesses are not violent and do not commit crimes. In fact, they're more likely to be the victim of crimes. However, there is a small subsection that are very dangerous, and I literally know that because that is my exact area of expertise. So those are people that I see in prisons that are sectioned within secure psychiatric units that are reserved for risky, dangerous, violent patients. So that's it basically. The stereotype or the misconception is that most people fall into that category. They absolutely categorically do not. It is the exception, but it's my area of expertise. Ben E, next question. Which mental disorders get the worst rap for criminal behaviour? Is that perception warranted? I think schizophrenia probably falls into that category. I think people misunderstand what it is. I've got a video on schizophrenia, what it is and what it isn't. Go check it out. Nothing to do with split personalities. And I don't think it's warranted. If people have a whole range of different symptoms, different types of auditory hallucinations, hearing voices, different types of delusions, some of them paranoid, but for a person to commit violence because of that, not only do the voices have to be telling them specifically to hurt people, or that, for example, people want to hurt them and they need to strike preemptively, but the patient has to actually go through the ethical and moral boundaries past that to actually commit violence, if that makes sense. So what I'm saying is that even though there's only a very small proportion of people with those particular symptomatologies would actually go on to commit violence. Whew. All right, Benny, more questions. Are there common trends that criminally insane individuals possess, e.g. types of crime, types of backgrounds, biosocial, social factors? So in terms of the people that I see in the forensic psychiatry system, it's usually a violent crime or a sexual crime. So it's usually assault. I always get asked in interviews about murders, serial killers. Actually, only a very, very small proportion of the patients I see have committed murders. Much more commonly, it would be actual bodily harm, grievous bodily harm, stabbings. Very rarely do I see things like fraud, for example. And in terms of their backgrounds, absolutely. So the vast majority of the patients I see have either some form of abuse, they've been abused themselves, physically, emotionally, sexually, neglect, poor parenting, they come from poverty, they often have problems with homelessness. All of those things can lead to mental illness, and separately, all of those things can lead to criminality. So unsurprisingly, the nexus, love that word, between the two, that is where I often see those factors. Right, Benny, your last question. Are there differences between criminally guilty by reason of insanity males and females? Well, there's no difference in the legality of it all. So the way that that's proved, the medico-legal criteria are the same. I'm not going to go into that now, but I have mentioned them in other videos if you're interested. That's all the same, but I would say that some diagnoses or some scenarios are more common in men, such as drug-induced psychosis. I've done videos on that, go check them out. Versus females. So with females, you might get things like postnatal depression or postnatal psychosis, also known as puerperal psychosis. Obviously, you can't get that in males. Well, there's a couple of tragic cases. One of Andrea Yates. I've done a video on her. Who, this is really sad. She became psychotic after the birth of all of her 5 children. Then in 2001, she killed them all. She drowned them because she was psychotic. And she eventually got a finding of not guilty by reason of insanity, but there's a lot of twists and turns in that becoming her defense. So she originally was found guilty of murder. It's complicated, but it is fascinating. Go check out my video on it. Whew. All right, next question, the one. I'm sure you've already had the one, so why are you called the one? Anyway, doctor, I only have 59 seconds to live. Have you got a minute? No. Next question, methane gummy bear. Multiple questions again. After this set of questions, we'll take a break. Okay. Methane gummy bear. How do you make sure the emotions from your field of work don't carry over into your personal life? If I were around people who have committed serious crimes a lot, I think it would cause me to have a very negative worldview. So my real question is, how do you mitigate that? That's something I get asked a lot. Methane, smelly name, gummy bear. I'm afraid I don't have a very strong answer to that. I think I've always naturally been able to detach myself personally. So maybe I'm a little bit of a psychopath, I don't know. But on top of that, I'm always very clear what my role is. So my role is only to assess people during their court cases to decide if they've got a mental illness or not. If they haven't, there's no need for me to be involved. They go down the criminal justice route. If they do have a mental illness, were they criminally culpable or not? And if so, if they were not, should they go to hospital or prison? And if they go to hospital, what type of hospital? What level of security? So what I'm trying to say is my decision-making process, my flow chart is very clear-cut. So I always have that in the back of my head. That is my role. My role is not and never should be to judge the individuals, because there's a whole court system to do that. There is a judge and a jury. I need to know in my head that I'm not part of that. And I think some of my colleagues do struggle with that, but I always don't. And finally, I've got quite an active life outside of my work, from making YouTubes to having a social life to having a young family, blah, blah, blah. So what I'm trying to say is that I don't have a lot of time to stew over cases. I'm always really, really busy with the next thing. All right, second question from Methane. Have you always wanted to know to go into psychiatry? I've kind of already answered that. No is the short answer. I kind of stumbled into it by accident, but fell in love with it. Third question, is there any psychiatric disorders which specifically interest you? I mean, there's the really rare ones that you kind of read about, or I would read about during my training, but you very rarely, if ever, see, like folie à deux. That'd be a great one. Which is when one person is psychotic and they spread their delusional beliefs onto another person. Only seen it once in my career, done a video about it, go check it out. And I've commented on it on a high profile case of these Swedish twins who literally jumped into traffic to try and kill themselves. One of them the next day went on to kill a random stranger. Also done a video on them, go check it out. And yeah, so those are the ones that interest me. The ones I see in my daily practice that interest me the most has to be the psychoses, like schizophrenia, because there's more of a question about whether they were criminally responsible and whether their symptoms caused them to commit a serious crime. So for example, if you take something like personality disorder, the vast majority, 90-95% of the time, people will be criminally culpable because they know what they're doing. Whereas something like a psychosis, if they were hearing voices, if they're having these specific paranoid delusions, then there's a chance that they didn't know what they were doing, or they didn't know what they were doing was wrong, so they might get the insanity plea, if that all makes sense. So I'm more interested in that type of illness because there's more of a role for me to really pull everything apart and sort of dig down into their thought process at the time of their violence, which to me is the most interesting part of my work. Okay. Fourth question is, are there any psychiatrists start that again. The fourth question is, are there any psychiatrists you look up to in particular, and why? Yeah, I would have to say Harley Quinn, because she's pretty badass. She stood up to the Joker. She didn't take any crap off him. She got her own film. It wasn't a great film, not as good as most Marvel films, but yeah, that's what I aspire to do eventually myself, become a anti-hero and have my own TV show. Okay, let's take a little break from all these questions. Before we do that, I just wanted to say a couple of things. Now that we've hit 10K subs, to celebrate, I'm going to revitalize an old nickname that I had from medical school, which is the ominous Sohom. So from now on, I'm going to call myself that. Feel free to refer to me as that. It's a bit more informal than Dr. Das. Next, I just wanted to tell you that there's potentially going to be some changes on this channel. So as always, I'll have brand new full episodes out on a Tuesday and a Friday, 6 p.m. UK time. But if I manage to find the right editor and there's a few things going on, I'm going to be repurposing a lot of material. So I'm going to be putting up a lot of small snippets of previous materials with a particular topic or purpose. I'm mentioning all of that because for all you loyal viewers and subscribers out there, I don't want you to be alarmed that things are changing and that loads and loads of content spewing out. You're still going to get original material at least twice a week, and an opportunity to review stuff, clips that you might not have seen before. Just want to say, please, please, please subscribe. Not only does it help me out immeasurably, but also deals with your pongy bad breath. So next question is from Ray J. Have you ever cried listening to a patient's story or history? No. I have definitely heard some really, really tragic tales. I've heard of people who are now committed fairly serious crimes, have been victims of abuse themselves. I remember one man telling me that his stepfather broke his arm when he was 6 months old. I've had people that have had years of physical and sexual abuse, so horrific stories. Never really cried. I'm not really a crier. I don't know what to tell you. I'm a big boy and I wear big boys pants. Next question, Daniel X. Seriously, one of my top 5 channels. You are so awesome. What do you mean top 5? What about, who are these other 4? No, I'm just kidding. Thank you, Daniel. I would like to ask you about therapeutic pessimism regarding the treatment of antisocial personality disorder. People act like someone with antisocial personality disorder is untreatable and cannot improve. And offenders with antisocial personality traits are treated like psychopaths or serial killers. What hope do you have for the treatment of antisocial personality disorder in or outside of the legal system? So that's a good question, Daniel. This is a bit of a sticky one because, very briefly, personality disorders are kind of inbuilt, entrenched flaws in one's character. I've done a video on what they are, go check that out. Got a lot of backlash, and I've done another video separately on whether labeling them is unfair, whole other topic. Antisocial is kind of controversial because by definition it's about people who have this disorder. They don't have empathy, they don't care about the difference between right and wrong, they don't, they act impulsively, they act aggressively. So almost by definition, they already are criminogenic. And some people think that it's kind of a bullshit diagnosis because it is just medicalizing criminality, which is kind of correct to a degree. I suppose the problem is if you have all those traits, then again, by definition, you're almost are certainly a repeat offender. So it's really, really hard to have much positive hope. Having said that, from my experience, people can change, but going through the system often doesn't really make that much of a difference. It has to be an internal change. And that comes from age, from maturity, from going through the same cycle of having the life, your own life and those around you being damaged, from you going to prison to, not being able to bring up your kids because you're in and out of prison and psychiatric units, to, not being able to get a job. So it's usually people have to go through that cycle and they have to have an inner epiphany before they change. There is treatment available. There are personality disorder units, for example. There's treatment in prisons. I'm not convinced that it's particularly effective because you get a lot of recidivism. So you get a lot of people coming back into the system years, months afterwards. So yeah, there is some hope and it can be treated, but the success rate is low. But you're also dealing with the most potentially dangerous, difficult, criminal-minded people in society. So, you've got to be realistic about what can be achieved. Okay, next question. Trina Scrimey. Have you ever been wrong in a diagnosis? And if so, how did it affect you and how did you learn from it? No, I never make mistakes. Next question. No, I'm kidding. Yes, I'm not wrong that often, not because I'm a great psychiatrist, although I am, but because the system is such that we observe patients within secure units for much longer periods of time than like on your general adult ward. And you get lots of other people on your team to help observe the patients, from nurses to junior doctors. So you've got a lot of backup, I guess, in making diagnoses. I have got it wrong, so I remember one case that really stands out, and I wrote about this in my book, which will be coming out in March 2022. It's going to be called In Two Minds. Stella is not her real name, but I've called her Stella in my book. So I still can't really get my head around why she did this, but she faked being mentally unwell. She was in a prison cell in the healthcare unit. She made dirty protests, was literally smearing feces on the ward, was screaming, was shouting. I was absolutely convinced she was psychotic. She was screaming for like 22 hours a day, literally. She was sleeping for 2 hours a day and spending the rest of the time banging on a cell wall. I thought she was absolutely off a rocker. Did organise a mental health act assessment. Meanwhile, all my colleagues in the prison who knew her very well, because they'd worked there longer and had treated her before, told me that she wasn't mentally unwell. She was just, they didn't really have an explanation. She was just agitated, but it wasn't driven by psychosis. I didn't believe them. I went against the grain and arranged this mental health act assessment. Turns out they were right. On the day of the mental health act assessment, she was absolutely fine. So it's a massive waste of resources by me calling out an independent doctor, social worker, loads of paperwork, blah, blah, blah. And they were right and I was wrong. What effect did it have on me? I mean, it was a little bit professionally embarrassing, I guess, because all my colleagues told me not to do it. I mean, they didn't say I couldn't do it, they just suggested I shouldn't do it. Yeah, it was a bit embarrassing. What did I learn from it? I guess that you can never be 100% sure, that you can only really go on what you think is right, but you can never know because as good a psychiatrist you may or may not be, there's always patients that are cleverer or more manipulative or deceitful, or are willing to go the further mile than you. Okay, next question, Dave Williams. I'm sure you've seen this lots of your time as a doctor. What's the strangest thing you've ever seen? What was the one thing that made you think, I will never be shocked again? Keep up the good work. I love your content. Love you too, Dave. I suppose the strangest things I'd ever seen, I probably would put that woman I was just talking about into that category, Stella. I've seen quite a few dirty protests in prisons, so people spewing feces. I've seen some horrific deliberate self-harm, again in prison. There's one woman called Pamela, not her real name, who I also talk about in my book, who self-harmed so severely that she was gushing blood around her cell in the healthcare unit, and they had to take her off to hospital for a start to get blood infusions and plastic surgery, but they were literally mopping up blood, I kid you not, in these hazmat suits. That was pretty intense. I have assessed a man, again I talk about him in my book, who removed his own eyeballs when he was psychotic. I didn't see that happen because I assessed him a couple of years later, but yeah, that's pretty nuts. The most emotionally draining case that I've ever seen was a young girl called Yasmin, not her real name, that I've talked about extensively in one of my other videos, who became psychotic and killed her own nephew because she was suffering from these delusional beliefs. That was a tragic case. She was only 18 years old when this happened, and the young boy was only about 3. One other case that just bizarrely popped into my head was a man who had these very bizarre black magic related delusional beliefs, and he thought that his urine was like protective, so almost every day he would urinate intentionally on his clothes, wear them or put them like around the psychiatric ward where he was to like ward off evil spirits. That was weird. And he'd even gone off to fight a bear in the wilderness. Luckily he was sectioned and found out before that happened, but that was, he was properly willing and ready to do that. Okay, next question. NDS. Similar to what someone else asked, but I'm wondering what it feels like to sit across from someone who has done something horrific to other people and try to dig into their minds. I know you've mentioned reserving judgment, but do you ever feel fear, hair standing up on the back of your neck, anything like that? Or like you yourself might be in danger whilst trying to establish a relationship with a patient? So I suppose NDS, I would split this into 2 kind of categories. So the people that I see for one-off assessments when I work as an expert witness to give evidence in the court, generally speaking, they're on their best behaviour because they know I'm writing an assessment that the judge is going to see, a report. Generally speaking. On the exception where they are very violent and agitated, there tend to be lots of other people in the room. So there's either prison officers in the room, or they're in the healthcare unit in their cell and the door's only opened. So honestly, the answer is I don't generally feel any fear. Within psychiatric units, particularly medium secure units, there is sometimes an element of danger and of violence, and it's usually in the context of me being in charge of a patient's care and them being frustrated or annoyed at something that's withheld, like leave into the community, or if they don't want a certain dose of medication. Things do kick off sometimes, and I've been punched in the face before. Doesn't happen that often though. I mean, I've worked with offenders for 15 years? Somewhere between 10 and 15 years, and I've been assaulted twice, maybe threatened, 20 times. So I'm talking about once a year or twice a year. It's not actually that high. So yeah, I don't know what else to say. I generally don't feel fear. I have occasionally, once or twice, but it's the exception. Jem McGregor, I asked this question in the last post. The short question is, how do you approach your psychiatrist if you disagree with the diagnosis he gave you and or you want to work with another doctor? That is a tricky one, Jem. I can only speak about the UK system. I don't know what country you're from, I'm afraid, and I presume it's different in different countries. If it's a private psychiatrist, if you're paying for therapy, then it's relatively simple. You don't have any obligation to use anybody. You can just say, I'm sorry, but I'm going with somebody else, and there's no reason that they're not allowed to feel frustrated because you're paying for a private service. If it's through the NHS, it's a bit more complicated because in the NHS, it's all about jurisdictions. So if you've been referred by your GP, then you're going to be seeing the main consultant within your geographical area. So say if you live in Camden, there'll be one consultant from Camden. So it's trickier, but I still think it's possible. I think you just have to be upright, honest and polite, and try and not make it personal, and don't say, I don't like you. Just say, I'm not quite confident in the work that we've done together. Is it okay if I get a second opinion? And they should be able to re-refer you to another consultant psychiatrist, possibly like in a neighbouring borough, which means you might have to travel a bit to get to that clinic, but they should be able to do that. I'm sorry I can't give you more of an insight. To be honest, the patients I see are sectioned against their will and they're very dangerous, so there's no such thing as asking for a second opinion. Okay, right, I'm going to take another quick break. I did promise you a present. I promised that you would get to see me battle rap against another doctor. This was a TV show called Don't Hate the Players. I recorded it about probably 3 years ago. Anyway, enjoy, this is it.
Look at this chump, take him out. Check it out. Yo. My agenda is to dismember this fool. Bet you've never met an incredibly cool tapper rapper who went to medical school. This is a message for the medical scene and every master of ceremony. I don't mean to be cocky, but evidently ain't no doctor or rapper that's better than me. Cause if you have gonorrhea and a tumor in your eyes and your ears, plus projectile diarrhea and bronchitis, halitosis, arthritis, cirrhosis, appendicitis, hemophilia, meningitis, anemia, cellulitis, and a liver disease, you still couldn't claim to be iller than me.
Yeah, just so you know, I did not in any way choose or volunteer to dress like that. The producers made me wear a lab coat with a purple bow tie. I've never seen a forensic psychiatrist wear that. I don't know. Okay, let's get on with these questions. So the next one is So Sad Marie. Can I ask why so many people say that a person committed suicide? I understand the phrase was used at a time where it was a crime, and depending on a religion, it was a sin. Suicide is no longer a crime or a sin, so why say committed? I work for a charity that deals with people who are bereaved by suicide. I'm also a mother who lost her son to suicide at age 17 years. Thanks for your view, Marie. Well, first of all, let me say, Marie, that's a very sad story, and I am genuinely very upset to hear what you've been through, and thank you for sharing that. Why do they use the term committed? I'm afraid I don't really have an answer for you. I'm not sure if there is an answer. I don't think it was a conscious decision. I know that suicide was considered a crime in England and Wales up until 1961. So that was, 60 years ago? Yeah, that's a long time ago, actually. I think it's just stayed in the vernacular. I don't think people that say it are saying it intentionally necessarily to suggest that it is a crime or sin, because I say commit suicide. That's not what I mean. I think it's just part of the English language because it's been in the English language for so long. But I kind of get your point. I think your point is that if you use terminology like that, then it makes people feel more judged who are feeling suicidal or have suicide attempts that fail, and I suppose it could be a hindrance into them accessing help because they feel like they might be judged. So I get what you're saying. I'm afraid I don't have an answer about why it's part of the language though. Sorry. Right, next question, 09RHM. Can you get psychosis with BPD, which is borderline personality disorder? Can BPD and schizophrenia be confused? I think my psychiatrist is questioning my diagnosis of schizophrenia as she doesn't seem to want to put me on a therapeutic dose of my medication after diagnosing me with psychosis. Okay, so first of all, BPD is borderline personality disorder. Shouldn't be confused with BPAD, which is bipolar affective disorder. I don't have time to go into both of those for now, but I've got videos on them on my channel. So psychosis very briefly is stepping out of reality. So it's usually hallucinations, typically hearing voices, or delusions, fixed, incorrect beliefs, often with a paranoid flavor. Borderline personality disorder is more about, it's not phases of psychosis or phases of mental illness. It's about yourself having these particular character features. Typically, they would be things like being emotionally unstable, so losing a temper, having explosive relationships, never really feeling fully happy, having problems with your identity, self-harming, taking risks, being impulsive. So that's, you know, a character person rather than an illness. Right, so there's quite a few different ways that they're connected. People with borderline personality disorder can have pseudo-psychotic experiences. So they're not true psychosis because you have a level of insight, but people might hear weird sounds as opposed to full-on voices, or they might feel kind of disconnected, like depersonalization or derealization, or they might have some odd, sometimes paranoid ideas, but they're not delusional in intensity. So that's one kind of way they're connected. Typical features of bipolar are very different from typical features of schizophrenia. So if you've got a pure one illness, it shouldn't be that hard to differentiate it with a pure version of another illness. But like all of mental health, there's grey areas. So you could actually have both. And I think that is a situation where the two symptoms can overlap and it can be confused. As for you, 𝐏09𝐏𝐬, why is your psychiatrist not wanting to put you on a therapeutic dose of your medication? Maybe, I can't say for definite because I've not assessed you or seen the psychiatrist notes, but my natural, my speculation would be that it's because he or she thinks that you might have borderline personality disorder because you've got other traits, and that what you experienced wasn't true psychosis, it was just like a decompensation of a pseudo-psychosis, which is because of your personality disorder, not because of any psychosis. So that person, your psychiatrist, doesn't want to give you these antipsychotics, which are harmful, loads of side effects, really bad for you in the long term, can decrease your life expectancy, can cause arrhythmias, heart attacks, etc. So maybe they think that you've got this, so they don't want to put you on that medication. That's my best guess. Right, next question. We're almost finished here. Jade Thomas. Which famous criminal, dead or alive, would you like to do an assessment with and why? Also, can I come and work for you? I think I would like to assess Anders Breivik because some people thought he had, some psychiatrists thought he had schizophrenia, some kind of psychiatrists thought he didn't and he was just narcissistic with a personality disorder. In case you don't know who he is, pretty sure you do. He's a Norwegian man who a few years ago killed, I think, like 69 people due to sort of very warped political beliefs. So I would like to see his justifications. I'd like to see whether he still feels those things right now. And just, it's hard for me to get my head around how somebody can have done that and not been psychotic, so not been out of touch with reality. I'm sure that's correct if that's what the psychiatrists say, but I'd like to examine exactly what he was doing, what he wanted to achieve, and yeah, just get an explanation of that, because it's just such an outrageously horrific event that I would like to understand it. And then also, if I'm allowed to choose another, I would say Ted Bundy, because he's supposed to be very charming and manipulative, and I just want to see to what degree he manages to draw me in with his charm, and also to hear his explanation for his murders. Okay, also Jade, you asked, can you come and work with me? No, sorry, afraid not. Next and final question, Karen Saunders. Why do you think so many young children are getting diagnosed with autism, ADHD, etc.? Are they getting misdiagnosed? Are they just developmentally delayed? Karen, that is a good question. It's very complicated. I've actually written, but not yet recorded, a video about that exact issue, autism overdiagnosis, recently. It should be out in the next few weeks. Please go check it out. I can't give you a full answer because it'll take too long, but very briefly, I think there's a few factors. I think the fact that we're in an internet age means it's so much easier to check symptoms. And some of the websites are accurate, some of them are not. So I think more people are feeling that they or their children have potentially some of these traits, and so therefore they look them up, are convinced that their kids have autism, ADHD, and push for a diagnosis. That's one thing. And I think awareness in general, which is kind of connected to that, has increased. That's another thing. So I think that's another reason that more people are doing it. Also, the tools to diagnose it have become streamlined and have developed. So it's a lot quicker and easier. Well, it's slow to get the appointment to get a diagnosis, but once you've got the appointment, it's quicker and easier to actually diagnose something like autism or ADHD compared to, say, a generation ago. Right, That's it for me answering questions. I really hope that was helpful. Hope that has given you a bit of an insight into my area of work. If you're interested at all about true crime or mental illness or the crossover between the two, then you've got to check out other videos on my channel, A Psych for Sore Minds. I do a whole range of things, talk about individual aspects that cause criminality, I talk about individual diagnoses, I dissect high-profile true crime cases, I interview people within the forensic psychiatry world who are kind of a big deal. What I'm trying to say is there's something for everybody on this channel. Go chiggity, check it out. That's all for me today. Stay euthymic, and remember, until next time, I love you.